the future, the hospital, tomorrow's hospital will in fact be in your own bedroom in the future. But this also creates a new opportunity. And what I will talk to you about today is try to visualize how our technology might meet some of the challenges that we were presented earlier from the augmented nurse problem. So it will both be addressing resource optimization. It will be tele and remote care presentation, and it will also be about risk prediction and prevention. The hospital at home system is a total system where we both have communication devices and we collect data from sensors. The sensors I will present today is the touchless sensor that we have specialized in. It is a sensor that is particularly suitable for use in the remote setting in patient's home, but it's also useful in an institution or a hospital setting, and I will get back to you on that. The sensor is also a sensor that can harvest data from other sensors. So you can combine sensor data from both the touchless sensors and sensors like pulse oximeters, blood pressure, temperature, blood sugar, spirometry, or weight. And the idea is that collecting data from these sensors should be as automated and as easy as possible. So what the touchless sensors does is it presents vital signs in real time, and that you can use for decision support, and we can use it with machine learning, artificial intelligence, and then you can have scoring algorithms, sleep analysis, trend analysis, and therefore we can also identify disease and predict deteriorations. Vital signs are, as the name says, vital, and nurses and healthcare professionals spend a lot of time monitoring, measuring vital signs. So having an automated vital sign device that can do this without the help from a human being will be a great saving. The touchless sensors that I will present is a type like this one. It's at the size of a matchbox, and when it's attached either to a chair or to a bed frame, it will turn the chair or the bed into a vital sign sensor. So as long as the patient is in the chair or in the bed, the sensor will collect the vital signs. It collects the data once a second, transmits it to the interface, which is a mobile phone, a tablet, or a PC. So it's both a vital sign monitor, but it's also a communication device that can communicate encrypted data to a receiver wherever that receiver is. There is no need for any help from anybody, not from the patient, not from a nurse, not from anybody. So as long as the patient is in bed, and the monitor will then continuously monitor and transmit the vital signs. This type of monitor is a type of monitors called ballistocardiographic sensors. There are three types of ballistocardiographic sensors. There are accelerometers, there are piezoelectric sensors, and there are radar technology. So the basic sensor is, the technology is based on the fact that the movement of blood through your body will generate a motion. The body motion will then be picked up by the chair or the bed that the patient is placed on, and then it will be filtered, and then we will pick up 4 measurements. It will pick up heart rate, respiration rate, heart rate variability, and relative stroke volume. Based on these measurements, you can have derived analysis like sleep analysis. The fact that we harvest these vital signs as often as once a second means that you will have generate a large amount of data, which again can be subjected to analysis from, for instance, artificial intelligence or machine learning. The data is transmitted to either the mobile device, like a mobile phone or a tablet, or to a computer, a PC. It communicates through most of the known communications platforms, either modem and the mobile network, through an Ethernet cable to the broadband. We can also communicate the data from the sensor through a hub or a gateway. And the usefulness of using or attaching a hub or gateway to this sensor is that we then also can collect data from other sensors, like cameras, microphones, and the other sensors that we talked about: blood pressure, pulse oximeter, respiration, weights and temperature and blood sugar. Everything is end-to-end encrypted, so it also is a safe way of transmitting data. Based on this, you can have automated alerts that can alert you if the various vital signs are deteriorating or deviating from the known. This is a short video just presenting the sensor. It can also be used alone. If you want to combine the sensor data with other data like cameras and pulse oximeters and these other, you need to have this gateway or hub that's in here. It's extremely easy to use. You connect it to the electricity or to the hub if that is needed, and that's all there is to it. You don't need any type of installations. When you have a private bed like this, you just leave the sensor underneath the mattress, or in a hospital bed, you would attach it to the frame, the metal frame. The data is then collected continuously on the user interface, either on the mobile or in the PC. And here you can see the pulse vital sign is compared with the pulse oximetry. The sensor works as long as you put it on the hand, and then it automatically connects the results. We have defined 5 levels of use of this, and these 5 levels will reflect the level of complexity that you can use this sensor with. One of the interesting aspects of this sensor is that it's just like a Lego brick. It's one sensor, and you can use it to many things, and you can adapt it to the organization or the infrastructure that the organization that you are going to use it with is familiar with. So the lowest level of this sensor use will be static information with alarms. That means you can have this attached to the beds in a hospital, and then you can at the same time see who is in bed and who is out of bed. And you can have alerts related to patients leaving the bed at times they shouldn't leave the bed, or we can have alerts telling them they did leave the bed, but if they don't get back in bed during night, for instance, within a certain amount of minutes, then you have an alert that can go. It will also give you an overview of how many beds are in use and where those beds are. You can combine it with the camera monitoring. So if you have an alert, you can open a camera and see if there's a problem. And you can combine it with the sleep analysis. So you can then have a notification telling you that patient X is in bed and he is sleeping, which will then be a sign that everything is okay. Then you can have a qualitative information of the status. Then you are down to the vital signs. You will then can have alerts if there is a deviation in respiration rate or heart rate. For instance, patients receiving opioids for pain treatment, they are then subjected to respiration depression, and you can have a alert telling you that this patient is now breathing very shallowly, very slowly. Combined with the sleep analysis, you can also use it for sleep apnea measurements. And you can use the data, the qualitative data measurements, to compare with other data. The alerts will then go directly to those needed. You will, in the system, decide who should get the alerts, and those will then have to acknowledge the alert and then make sure that action has been taken. Over time, you could see trends. What you see here is a typical trend of a patient over several nights and days, and you can see that the line is the respiration rate, and the other is the pulse heart rate. And there are distinct drops in respiration, both respiration rate and heart rate, and that is due to the delivery of analgesics. The top you can see is when the patient is in pain, he will have a increased heart rate, an increased respiration rate, receives an analgesics, and then you can see the heart rate, respiration rate goes back down. The trend will then be able to give you, like this the last slide showed you. It will show you simultaneously trends of different parameters. In the previous slide, we showed the heart rate and the respiration rate, but you could also use it with the heart rate variability or the stroke volume, or you can even connect it to other type of measurements like the pulse oximetry. You will then also have an automated documentation on patients. You don't have to walk into a room and notify the vital signs. And you can use it for prioritizing patients. You can see who will be at risk, and you can have then advanced reports. You can simplify the workload, and the individualization of alerts is a new thing. You can use, for instance, machine learning to identify each patient's normal variation during night of their vital signs, and then set alerts depending on their individual profiles. We have a number of automated algorithms like NEWS, which is the National Early Warning Score. We can combine it with manual inputs. And by doing this, you can have a decision support system ready for you. This, what I've presented so far, is what we already use, and we have it in patients. We have 150 patients who have seen this, are using this system. We have used the system for 200 patients with COVID-19. But what we're going to present now is a more future of this sensor, the use of this sensor. This is the research part of what we're doing. And that is the task of trying to identify disease and predict deteriorations. This is not an area where we have validated and certified everything, but this is where research is an ongoing matter. Like I said, the huge amount of data is in one way a source of knowledge. On the other hand, huge amount of data can be a source of confusion. So one of the big challenges that we see is that we want to transform data into information and into actionable advice. So instead of looking at confusing charts like the one to the left, we'd like instead to have clear commands like give this patient a painkiller, contact the doctor, or something like that. But what you see here is a patient with epilepsy, and where we were able to predict before the epileptic seizure occurred with the use of artificial intelligence at the accuracy of 0.9 and a precision of 0.85, which is very, very good, and it's very promising when it comes to the future further research we are doing, and what I will also invite others to participate in and to see what you can do with this type of data. I'd like also to stress that you can use this type of data as tools for resource management in a hospital. If you know the burden of the patients you have, you can also allocate personnel to the right patients to the right time. And of course, the ongoing research is continuously validating the new development of what we have. For instance, since we can detect stroke volume, could we also then detect the cardiac output? And having a very easy, very inexpensive way of detecting cardiac output will also be a measurement of, will be a helpful measurement in the monitoring of patients with cardiac disease. And what we are working with is having these sensors into stretchers that can be following the patients from a site of an accident, for instance, during transportation and into the hospital and back to the patient's home. This will be a helpful tool in the triage of patients on an accident, in site of accident, but it can also be very useful because you have a patient-centric measurement system that can be used. The same sensor can be used both during transportation in the hospital and also back in the home setting. The research we're doing is at the moment 2 projects. One is the project I mentioned about monitoring of patients with COVID-19. 200 patients with COVID-19 treated at home were monitored with this monitoring system, the bed sensor. And the outcome was very favorable. It detected, it was able to detect deterioration before they happened, and it was more accurate than the pulse oximeter in the detection of who was at risk. It is actually today presented at an international conference of anesthesiologists and intensive care doctors in Scandinavia, and it's we are now also preparing a paper to be published in the JAMA. We are then moving on to look at the monitoring of the patients in the pre-hospital scenes. The reason we are doing this is that this is the most challenging place we can monitor or use this systems in. So if we can validate the use for these sensors in emergency outpatient or pre-hospital settings, it will be a very strong validation of the technology in itself. To summarize the touchless monitor, it is useful because it can allow scalability without increasing personnel. You can have a number of patients in a number of locations, and you can have one person looking after all these patients without increasing the number. In the COVID-19 setting, you reduced contagion because you can have an effective monitoring of patients without having to actually see the patient every time. So reduce the number of actual contacts with patients. By using this as a home monitoring, you could also reduce the burden on hospitals because you could increase the home monitoring, home treatment of the hospitals, which is the real hospital at home setting that we are specializing. And it will also reduce the workload and cognitive stress for healthcare personnel in situations that are very stressful. For instance, situation where there is a overload of patients and you need to make sure that everybody is safe. You will have this system looking after the patients you don't have time for at that particular time, and you will get alert if something is wrong. So it will both be economically, it will be reducing the resource requirement, but it will also increase the quality of the care. So this is my presentation. So I hope you will have some question if I can manage to stop sharing my screen.
Yep, okay, that's good. Thanks, Vidar. So now we are into Q&A session. Anybody has question can just unmute yourself, or you can also type it in the chat box. Maybe I start with the first question. Vidar, you mentioned about the COVID patient. Just want to understand better, which are the vital signs that was being monitored? Was it the respiratory rate?
What we monitored in the COVID-19 patients was the continuous monitoring with this bed sensor that gives you heart rate, respiration rate, relative stroke volume, and heart rate variability. Those 4 measurements were done continuously. And then in addition to that, we monitored pulse oximetry, blood pressure, and temperature. And the findings in a home setting was that patients with the more sick the patients were, the more difficult they found it was doing easy things like putting a pulse oximeter.
Sorry, Vita, we lost you for a moment.
Am I back now?
Yes, we lost your audio for a moment. Yeah.
I'm sorry about that. Now, what I was saying is that as long as you are dependent on the helper, the patient to use other type of sensors, you need to make sure that the human factor is solid. You need to know that what they're doing is actually what they're doing. The strength of the bed sensor was that it was independent of the help from a patient or a helper, and the amount of data provided was much superior to having one-time measurements of blood pressure, temperature that we did 4 times a day.
Yeah, that's true. So we have a question from Suhan of SGH. She's asking, is the data stored in cloud? Where is the data that is being captured by the sensor? Just now we see there is a box that actually acts as a data integrator. So where is the data being stored?
Yes, now I can see the data is stored in the cloud. Yes, the data is stored wherever you like it to be stored. So what we'll deliver is a stream of data that you decide where you want to store it. We have a Azure server that we store it in ourselves, but that's for the user to decide where they want to have the data. The readings are diagnostics, but I wouldn't say it is diagnostic because we haven't validated that yet, but it will be. But we use it as an addition to other measurements. We use it as a monitoring to help us identify who we should use our resources on. So having, for instance, increased heart rate or increased respiration rate or decreased respiration rate is obviously very useful information, but you couldn't at this stage do a diagnostic from it. Our hope is that we in the future will be able to identify biometric fingerprints of each diagnosis, but this is future work. But like I said, the sensor can be used both as a very simple tool for identifying people in bed, but you can also use it in research to identify complex diseases. And you can also, like I showed in the epileptic case, use it as a predictor for an epileptic seizure or a predictor for deteriorations of diseases and conditions.
So Vita, as you mentioned earlier, is you are applying the new standard, which is early warning system kind of way of assessment. So this is not considered as a medical device. It is considered as an early warning system.
Yes, but we are working on the validation, and we are continuing. So we expect it to be a medical device within the next year.
In fact, I remember when I was working on vital sign monitoring for patient remote monitoring, one clinician came to me and said respiratory rate is actually the most effective way of early warning, even better than blood pressure. Yeah.
Now we will then have to combine it. So what we are working on is to find or find a way of automatic combining these sensors with other sensors like blood pressure and pulse oximeters, which are medical devices. So we combine different medical devices with this sensor, and like I said, within a year, we expect this also to have received medical device certification.
So another question for Yungi, is there any potential environmental or external factors which will affect the accuracy of the reading, or any particular setting to take note of?
Yes, there is. We are using two different sensors. The accelerometer is at the moment, at least, dependent on a solid surface, a solid floor. An old wooden floor wouldn't give you accurate measurements. If you have a concrete floor, the measurements are very, very accurate. But this is the downside with the accelerometer. On the other hand, we have piezoelectric sensors that do the same thing, and these are independent of the environment. So our environmental challenges will be excluded. We will be identifying where to use it. So therefore, when you use equipment like this, it's important to choose the right sensor depending on the environment it should be used in.
I think there's no issue in Singapore. We don't have wooden floor. But we used to have carpeted floor in the early days before COVID. Will carpeted floor be an issue, or vinyl floor?
Say that again.
Carpeted floor.
Competitors?
No, carpet floor.
On the bed floor?
No, the floor is laid with carpet.
No, that doesn't matter. No, that doesn't matter at all. Carpet, it doesn't matter. The matter is that if you have a wooden floor, that will
vibrate.
Will be moving if you walk there. That will be picked up. But if you use the piezoelectric sensors, you eliminate that bias. So it's depending on where you want to use it, it's very reliable. Vinyl doesn't. It's okay with vinyl. You can use anything. The stability of the floor is the key, and what's upon the floor, whether it's a carpet, vinyl, or wood, or whatever, it doesn't matter. But if there's no concrete below it, it will be a problem.
Basically, you're talking about a concrete structure as compared to a wooden structure, right? So in Singapore, our buildings are all concrete structure. We don't have wooden structure buildings. Yeah. So we are okay with all this.
Okay. Yeah.
So this Singapore will be a good test bed for you. So I see this system as a very good early warning system before, especially how to focus the nursing resources on patients that actually need more immediate care by monitoring their early warning symptoms. Yeah. So another question is, one router to one sensor, as you shown in your video just now, and can it be wireless?
Yes, it can both be wireless. We communicate through all the known ways of doing it. You can use the sensor without the router or without the hub, and then it communicates either on a Segway, on a mobile network, or a Wi-Fi. And then if you want to combine more than one or collect more information from more sensors or cameras on one patient, you need one hub for each patient in order to make sure that who is there. I said that we use this both. It can be used both in a chair and in a bed. The problem with using it in a chair is that you don't know every time who is actually sitting in that chair, while who is lying in a bed is usually the same person. So, but it is an interesting tool for looking after people who is handicapped and are spending much of their time in a wheelchair, for instance.
Thank you. Bye-bye. Okay, if there's no more question, we'll end the Q&A session here, but nevertheless, you can always email to me if you have further questions or you want to have more inquiry on these sensors from Omsyn. So my email is on the screen. You can capture that. And also for Monday, on the 13th of June, we have 2 more companies coming on to present, 3 p.m. Selenium and 4 p.m. 3D Cell. So thanks everybody. Thanks for attending on this Friday afternoon. Hope to see you in the next session again. Thank you. Bye.
Bye-bye.